This is Dr. David Drozik from the Lifestyle Medicine Clinic, and we want to answer the question, what's up with carbohydrates? You can find this video on our website. If you're finding us on YouTube, I would encourage you to take a look at our website. We'll be posting this video in particular in the Sleep Soundly section, as well as the PowerPoint with the slides available. You can also email me. I'm happy to send you the slides, as we're going to quote some science, and you may want to look a little closer at those articles. So high carb, low carb, what's the best diet? Do carbs cause diabetes and obesity? We need to answer that question. Not all carbs are created equal, and we'll look at that a little bit more closely, and that's where the confusion comes. So why are low-carb diets so often prescribed? Well, it depends on your paradigm, and I'm going to encourage you to consider a new paradigm as you think about carbohydrates. The general paradigm in medicine overall today can be illustrated by a sink that's clogged with the water running and the water's running over on the floor. And we, in current medicine, spend our time mopping up the floor. So you can think of the floor as high blood sugars or as overweight and obesity, and we spend our time with surgery and medications trying to control the damage from the overflowing sink. What we do in lifestyle medicine is we go up to the source of the water and the source of the clog, and we deal with the cause, which is a quite different treatment. So I'd like to suggest that the fork is the most important determinant of your health unless you're a smoker. And then it's number 2. There's an eating continuum that I recommend for my patients to consider. The things on the left in the red are what are causing our chronic lifestyle-related diseases, such as cardiovascular disease, diabetes, our obesity epidemic. What we need to do is move over into the green and eat more plants, fruits, vegetables, legumes, which are beans, peas, and lentils, and whole grains, and save those things on the left, those animal products and processed foods, for special occasions. We're going to show you some science behind that to help you understand why this is the healthiest diet. Any diet that restricts calories will help you cause weight loss, but it may not be healthy. Think about things like anorexia, chemotherapy. They'll help you lose weight, but it's not necessarily healthy. So weight loss is not equivalent to health. Let's look at these low-carb diets, which are really so popular, and they continue to be popular throughout the ages, decade after decade. They're reinvented with new names, but they all are pretty familiar. Right now, that paleo diet is pretty common, where we're trying to live like our ancestors and eat the things that the hunter-gatherer would get. But those who are expert in the true paleo diet tell us that our ancestors ate over 100 grams of fiber a day, which indicates that 95% or more of their diet was plant-based. The average American, by comparison, is only eating 10 to 15 grams of fiber a day. Chimps, which are the best equivalent to our ancestral diet, eat only 2 to 5% of their calories from animal products, and that's episodically. The keto diet is another very common popular diet. It's a form of a low-carbohydrate diet. The science does show that there is some potential benefit for the ketogenic diets. On the short term, there is weight loss and blood sugar level control and lipid controls, or those fatty molecules in the bloodstream like cholesterol. There's also some possible long-term benefits, especially for children who have epilepsy that can't be controlled otherwise, and some early research suggesting maybe there's some benefits for people with Alzheimer's, Parkinson's, or glaucoma. However, when you follow these diets out long term, you find that they're not so beneficial. The ketogenic diets cause inflammation. They also cause insulin resistance and beta cell dysfunction, which are two characteristics of diabetes. And indeed, if you follow people on the ketogenic diet long enough, you find that there's an increased risk of diabetes, as well as cardiovascular disease, many cancers, fatty liver disease, kidney disease, osteoporosis, and death from all causes. These low carbohydrate diets in general all increase the risk of diabetes and increase all-cause death or mortality unless they are plant-based. So if you want to follow a low carbohydrate diet, you should make it plant-based, and then you'll lower your risk of cardiovascular death and of all-cause mortality. The American Heart Association says that those diets that are high in animal protein and low in carbohydrates, which most of these low carbohydrate diets are in the U.S., actually are not beneficial. They're deficient in many of those phytonutrients. They do not reverse heart disease and probably accelerate it, and they increase the risk of cancer and diabetes death. But again, they say if you want to do a low carbohydrate diet, if you substitute plant protein for the animal protein, the negatives go away. Let's take a short stroll through some history, because we've known a lot about carbohydrate and diabetes that we seem to have forgotten. Back in 1927, Dr. Shirley Sweeney at a medical school in Texas took a group of healthy male medical students, and he put them on one of 4 different diets for 2 days. A quarter of them were on a carbohydrate diet, and when you look at the carbohydrate diet, it's a mixture of what we would think of as good carbohydrates and bad carbohydrates. He put another quarter on a lean meat and egg white diet. He put another quarter on a fat diet, which has some pretty high fat items in it, and a starvation diet for the last group, meaning they only had water to drink. After 48 hours, he gave them a glucose tolerance test, which for many years has been the standard for diagnosing diabetes. And the cutoff for that glucose tolerance test to be normal is 140. When you look at what happened, only those eating the carbohydrate diet had a normal glucose tolerance test. Everyone else with that high protein diet or the high fat diet were above normal. Their blood sugars were elevated. So that raises the question, what's going on? Glucose intolerance, or the risk of diabetes, goes up with a high protein diet, especially with a high fat diet, but not with the high carbohydrate diet. So what's that telling us about what we eat today? Well, Hemsworth took this a little bit further. He took a group of healthy volunteers and he controlled their diet for a week. Those with a high fat diet after 1 week had elevated blood glucose levels with their fasting glucose tolerance test in the diabetic range. And those who were eating the high carbohydrate diet were normal. Here's what it looked like on their graph. You can see that those who ate the high fat diet, and that was predominantly animal fat, had a higher reading in their glucose tolerance test and would actually achieve a diagnosis of prediabetes or diabetes. Hemsworth said with his research and others that were being done at the time that he thought this was irrefutable proof that a liberal allowance of carbohydrate acts favorably on the diabetic's health. Rabinowitz took this to the next level. He'd been following his diabetic patients for many years, has documented medication levels and lab testing, and they were on a low carbohydrate diet. He switched 150 to a high carbohydrate diet and found out that their insulin needs reduced rapidly and that they had improvement in their lipid or blood fat levels. He wrote, "It is necessary to modify the prevalent conception of the metabolism of diabetes. Carbohydrates improve, whereas fats impair carbohydrate tolerance." And then in 1939, Dr. Kempner at Duke University brought people with advanced diabetes, advanced heart disease, kidney disease, eye disease into his residential clinic, and he put them on the rice diet. That's not an acronym. That's what it sounds like. It was white rice with vegetables. But white rice is supposed to make things like diabetes worse. Well, it depends on your paradigm. Are you trying to reverse the disease or just manage the blood sugar levels? White rice had been common in China for 150 years, and people had minimal type 2 diabetes. They also had minimal coronary artery disease. The average cholesterol in China for people eating white rice and vegetables was 127, with average in the U.S. for that same time period was about 203. Normal in the U.S. is considered under 200, and yet half the people with heart attacks have, quote, normal cholesterol levels in the U.S. Maybe we should be looking for an ideal cholesterol closer to that of the people in China. Well, then the Western diet entered into China and Japan, and now they are rivaling us in their levels of diabetes. In the 70s, Nathan Pritikin was able to actually reverse the symptoms of heart disease with a plant-based diet, physical activity, and stress management. Dean Ornish took this a little bit further with a nice controlled study that showed imaging reversal of coronary artery disease with a plant-based diet. There's nothing else out there that we have in our treatment armamentarium that can actually reverse coronary artery disease. Dr. Esselstyn proved this with angiography, and he also showed, along with reversing the cardiovascular disease, people got off their medicines for hypertension, diabetes. They actually had reversal of these diseases. Neil Barnard took this to the next step and actually compared a plant-based low-fat diet, which he called a vegan low-fat diet, to the American Diabetes Association low-carb diet, and after 22 weeks, the plant-based diet was superior in reducing the hemoglobin A1C to the low-carb diets from the American Diabetes Association. He also showed that their lipid levels improved significantly over that of the American Diabetes Association diet. Dr. McDougall, who promotes a high-starch diet, which is a complex carbohydrate, has his residential center, and within 10 days, his participants get off of their medicines for diabetes and hypertension, and they go home and stay off the medicines if they stay on his diet, actually reversing the disease. A less aggressive approach is the Complete Health Improvement Program, or CHIP, where people don't go to the residential center, they live at home and then just go to some community-based programs. Half the people with diabetes that attended the CHIP programs that were studied were able to get off of their insulin. So the question is, are we just managing high blood sugars, or are we actually reversing the cause of diabetes? So what is the cause of diabetes? Well, we can get a hint of that from National Geographic study of the blue zones. Dan Buettner was commissioned by National Geographic in 2012 to find the places where people live the longest and the healthiest in the world. He found 5 of those, and he found that the common factors were, number 1, a high carbohydrate diet. Most are grain-based. 4 out of the 5 are grain-based. 1 is yam or sweet potato-based. They all eat lots of legumes. And on the average, they only have a small portion of meat a week. None of them use cow's dairy. They also move naturally. Lots of them are farmers. They have a purpose in living and a supportive community where everyone does this together. There's only one blue zone in the United States, and that's in Loma Linda, California, among the Seventh-day Adventist community. We can learn a lot about carbohydrates by looking at the Adventist health studies. These have been going on for more than 25 years and continue to look at different aspects of the blue zones, the way our Seventh-day Adventist community lives. Seventh-day Adventists generally don't eat pork, they don't smoke, and they don't drink alcohol, and they encourage a plant-based diet. When you look at how their diet was broken down, this is a group of people that were followed for 25 years. They were healthy to start with, and they wanted to see what happened to them over the period of time that they were studied based on what they ate. About 8% ate a vegan diet, and this is a healthy vegan diet, and we'll talk about that in just a minute. 28% added some eggs and dairy to that. About 10% added fish to that. Another 5 to 6% added some poultry and some meat, again in smaller portions. This would be equivalent probably to our Mediterranean diet, which is again a popular diet promoted by health professionals. And then about 48%, almost half, had more of a standard diet. But remember, this community is encouraging a vegetarian diet. The Garden of Eden diet, theologically, is what they are encouraging. So this won't be really representative of the standard American diet, which also would include pork, while their diet would not. But yet this is highly informative to us. After 25 years, this is the only slide that's going to break the females down from the males, the men and the women. When we look at weight, over here is the plant-based diet, and as you add additional animal products, you see a generalized stair-stepping up. As a group, for both the women and the men, the only group as a whole that was normal weight were those eating a totally plant-based diet. As they added animal products, the weight went up. When they looked at who developed diabetes, less than 2% eating a plant-based diet developed diabetes. But as you add the animal products, you can see what happens. The risk of diabetes goes up. So here's this Mediterranean diet, which is promoted as a good diet, and it's better than the standard diet, but there's a better diet yet. As you peel off those animal products, the risk of diabetes goes down. So this is probably the genetic factor. The rest of this is lifestyle related, predominantly from diet. So when we look at the standard American diet, which is the SAD diet, the Adventists only had about 7% that developed diabetes, but in the standard American diet, we're talking about 14 to 15%. And where I live in southeast Ohio, about 30% of the adults have diabetes. So the diet seems to be playing quite a role in here. The good news is if you switch the diet, you can oftentimes reverse this and bring it down. I would encourage you to read my own story where I was able to reverse my own diabetes and high cholesterol and high blood pressure with changing to a plant-based diet, normalizing all my numbers and losing about 30 pounds. So there are many risk factors. When we look at these population studies, we find associations. What do people eat who have higher levels of diabetes? Well, we see things like processed meats, and we find a risk of about 50% increase of diabetes with eating processed meats. People who ate meat once a week had an increased risk of about 30% for diabetes. And regular meat consumption doubles the risk of diabetes. Another study indicated that as little as 5% of your calories coming from animal protein was associated with a 30% increased risk of diabetes. That's like less than a skinless chicken breast a day. Eggs were associated with an increased risk of diabetes. 1 egg a week had measurable increased risk. 2 to 3 eggs doubled the risk. 5 eggs tripled the risk. And if you already have diabetes, 1 egg a week was associated with a doubling of the risk of heart disease. Let's look at blood pressure. The same thing. We see that those who were eating a completely plant-based diet, less than 10% developed high blood pressure over those 25 years. But as you add the animal products, again, here's the Mediterranean diet, better than the standard diet, the risk went up to nearly 25%. Cholesterol, the same thing. Cholesterol being very high in the Mediterranean diet, not much improvement over the standard diet. So some of you are thinking, well, where do I get my protein then if I should be avoiding these animal sources of protein? So I want you to think about the steak really as being fat, 60% fat, more than the protein. Those cheeses and processed meats can be 70 to 80% fat rather than protein. So if you want your protein, you only need about 5 to 10% of your calories coming from protein. Get it from beans and broccoli. Get it where horses and cows and gorillas and elephants with their big musculature, where do they get it? They get it from plants, and we can too. So there's your protein, beans and greens. What about calcium? Don't I need milk products for my bones? Well, actually you don't. Beans and greens will give you all the calcium you need. So what's going on? Well, we're talking about the underlying cause of diabetes rather than treating the results of diabetes, which are the high blood sugars. Many experts believe the underlying common cause to all of these lifestyle-related diseases like diabetes and cardiovascular disease and autoimmune diseases is inflammation. Inflammation's a normal response to invasion or injury. When you cut your hand, it gets swollen and red. That's inflammation, and then it heals. But we find out that any animal products and processed foods that are high in concentrated sugars like high fructose corn syrup or bleached flours like in pastries, any of these cause inflammation. There's some environmental things like glyphosate, the wheat killer, and some people have a genetic predisposition to yeast or gluten causing this. But within 20 minutes of eating an animal product, I can measure an increase in inflammation in you by drawing some blood. Your white blood count goes up, your sedimentation rate goes up, and it lasts for about 6 hours. So our problem is we have our milk and yogurt. So the problem is we have our cereal in the morning with milk and our sugar on it, and that causes us inflammation. And then at noon we have our chicken salad sandwich, which boosts the inflammation before it subsides. And then for dinner, before the inflammation subsides, we have our pork chop, and then we have that bowl of ice cream before we go to bed. And all day our body is in this state of inflammation, and it doesn't clear up until 2 or 3 in the morning. We know that our body does its best repair work, and it deals with the damage from that inflammation at night while we're asleep. But what we're doing is robbing our sleep of the opportunity to repair the damage, because the damage is ongoing as we go to bed and throughout the first part of our sleep. So what we need to do is free up our bodies from that inflammation so we can heal. And the good news is that all these plants are anti-inflammatory. So we want you to eat more of the plants, the fruits, the vegetables, the legumes, the whole grains, less of those animal products and processed foods. Not to say that you can't ever enjoy them. Save them for celebrations, but those celebrations should be for special occasions, like Thanksgiving, Christmas, a birthday. Not every day, 3 times a day. Certainly not more than once or twice a week at the most. The AMA is recognizing this lifestyle medicine importance and is suggesting that this should be the first and primary mode of preventing and treating chronic disease. However, it's being ignored, partly because it hasn't been included in the training for the doctors that are out there right now. But it is changing. The new wave of physicians and dietitians hopefully will have a better grasp on the plant-based diet as being a powerful tool to help treat diabetes, heart disease, obesity. So I want you to think about food as medicine. The most important determinant of your health is that fork, unless you smoke. What's the dosage? Well, before we give you the specifics, I wanted to go through 2 more studies that are related, that were done by a group from Harvard, where they looked back on populations, about 200,000 people from 3 different groups that were followed for over 20 years and had good dietary data from what people were eating. And what they wanted to do is not like the Adventist Health Study, see if what people ate the whole 20 years as a specific diet did to them, but what did certain portions of food, their eating habits. So these weren't people that necessarily fell into a specific category such as vegetarian or vegan, but looking at what they generally ate during that period of time. And they broke this down into animal products being in one group, and then plant-based products in another group, and then they divided the plant-based products into 2, an unhealthy group and a healthy group. The unhealthy group was predominantly processed foods. Those potatoes here are predominantly French fries and potato chips. And then this vegetable oil, which I would generally put in this unhealthy group because I think it's highly processed, it's concentrated fat. I know there's lots of people that promote vegetable oil. That's a story for a different day. You can find in our website on the Fill Up with Fiber some ideas about the vegetable oils in particular, but that's a minimal factor overall in this study. And what they found here, this horizontal gray line, is the risk for cardiovascular disease. The blue dotted line is looking at plant products in general, and the more plant products in general that people ate, the lower their risk of cardiovascular disease. This red line is the healthy plant-based foods, and the more you ate, the lower the risk of cardiovascular disease. Up here are the unhealthy plant-based foods, the pastries, the French fries, the potato chips, and the more you ate, the higher the risk of cardiovascular disease. Then they added in the animal products, this red line, and they found the more animal products you eat, the higher your risk of cardiovascular disease because of the saturated fats and cholesterol in those. While the unhealthy plant-based diets, portion per portion, were actually worse than even the animal products. So those highly processed foods, this is what has given carbohydrates the bad name. These are the carbohydrates to avoid, not those healthy plant-based whole food carbohydrates. They did the same study looking at people who developed diabetes over the time, and they found that here's the average risk for developing diabetes. The plant-based whole foods down here, the healthy plant-based whole foods are the green line, so the more you eat, the lower your risk of diabetes. The unhealthy plant-based foods, the more you eat, the higher your risk of diabetes. So again, the French fries, the potato chips, the processed pastries, going to increase the risk. These are the bad carbs to avoid, but the good carbs, fruits, vegetables, whole grains, legumes, decrease that risk of diabetes. Now the DASH diet's another diet similar to the Mediterranean diet that's promoted a lot. However, if you look at it closely, the people who did the study actually wrote and said that really a vegetarian diet was better yet, but they didn't think people would be willing to go vegetarian. So they tried to do their best with a Mediterranean-like diet to make it more palatable. But to just offer you the Mediterranean diet or the DASH diet without this knowledge, I think is cheating you of the opportunity to know what you can do to really even reverse your disease, not just slow it down. So you might be thinking, well, moderation, that's what we want. A little bit of this, a little bit of that. You don't want to be so extreme. Well, that's fine if you want moderate diabetes and moderate heart disease and moderate death. That's up to you to choose. If you only want to go this far on the spectrum, then you're only going to get this much benefit. The further you go down the spectrum, the better the benefit. If you want to reverse the cardiovascular disease and reverse the diabetes and reverse permanently that obesity and those autoimmune diseases, you need to move down the line and work toward that plant-based diet. Not everyone's going to get 100% reversal. It depends on how much damage is already done, but many people who work down this spectrum find that they can roll back the clock on their diseases, decrease their medicines, and live a healthier, longer life. So in summary, what's the prescription? I encourage my patients to get up to 40 grams of fiber a day, at least 75% of their plate with foods rich in fiber and water, a cup of legumes a day. Minimize those animal products and processed foods. If you're going to eat them all together on a celebration day. Get all the inflammation over with at one point, and do that no more than 1 to 2 times a week. For more information on details of how to implement this kind of lifestyle, I'd recommend that you look at our website, thelifestylemedicineclinic.us, and I ask, are you ready for health?